Okay, we are back. This is Senate Health and Welfare, and we're looking at some information from other states and what other states have done, including the lead inclusion in cosmetics. So, Marcy, thank you for being here. Why don't you introduce yourself for the record and just take a few minutes to walk us through what's what.
Okay, yes, so for the record, Marcy Gallagher, I'm Vicky Beeford, hello. And I apologize, again, this is gonna be a little bit of a hodgepodge. This was my slide from the House where we had also proposed adding cleaning products, but that did not get added, so you can disregard the cleaning products here. I also just threw together some dates in this Google Doc, maybe make it a little bit more clear. And then I have a separate slide on personal care products. So sorry, we're gonna jump around a little bit, but if we look here for cooking products and kids products, I just mentioned I put Maine in parentheses because they had a larger PFAS ban from basically all products, but that was taking a long time to implement, and they just passed an amendment to actually focus in on some specific products. So Maine no longer needs to be in parentheses here. They did actually ban cooking products, and Minnesota has banned PFAS for cooking products, and it's proposed in several other states.
Just a question about vapor.
Yes.
Do you have an expert? Are you exclusive to Vermont?
Paul Burns, Director of VPIRG. There are PIRGs in about 33, 34 states that have their own individual state-run organizations.
Thanks.
And I'm assuming the ban means at all levels, none whatsoever.
Yes, but it is, I think, our bill, and I think these also are intentionally added PFAS.
Okay, I think I understand that.
Yeah, intentionally added means part of the product itself. It wasn't part of the contamination during manufacturing.
Oh, okay, yeah.
For cooking products, it's more clear than some other products, but it's Teflon because it's added to be nonstick.
Right.
Kid products actually, so California's PFAS ban on juvenile products has already gone into effect, and it's been done in several other states. Maine just passed theirs, it was included in Minnesota's, and so the industry is already kind of well on their way to getting PFAS out of kids' products. Actually, I'll jump to this then. So you may remember from last year, we were basing our cosmetics language largely off Washington's bill, which at the time had not passed. Since S-25 passed the Senate last year, Washington's bill became law, and also Oregon's bill that was also mumbled after Washington's.
Always
became law.
repeating this.
Yes.
I have to say though, little factoid, I presented emerging issues at NCSL out west somewhere. And Washington State senators, Oregon senators and representatives showed up. And they went, oh. That was fun. It's still stigmatized.
So our list is largely based off of Washington's. We do have 3 chemicals that were not, and actually more than that, because the House ended up adding some more. So we are not banning any chemicals that haven't been banned in any other state. There's just some states that have done more than others. So our list includes chemicals banned in New York, California, and Washington. So 1,4-dioxane was done in New York, the parabens were done in California, and then 2 other chemicals, D4, that's like the cyclotetrasilazane. I'm gonna call it D4 because it's shorter. And styrene, both out of California. So those are all in this bill, but again, all of them have been banned in other states. But what's fun about that is that the ones in California aren't banned until 2027. So in your language now, those 3-4 chemicals are bumped out a little bit later than the rest of them.
Yeah, I'll have to look at the dates.
But all of the chemicals banned by Washington and Oregon will be going into effect January 1st of 2025. So coming right up. To jump back up here, Minnesota's, all of their bans go into effect January 1 of 2025. Maine recently passed, it'll bump theirs out to 2026. And they do include cosmetics, menstrual products, but it's just PFAS, not all that whole list of chemicals that we have and that Washington and Oregon have. And then Maine did January 1st, 2029 for artificial turf. That's all those dates.
Are we gonna be able to get this on our webpage so we can refer?
Yes, I'll make this look a little better, but I won't spend too much time on it and I'll send it to you right after this.
It's not how it looks.
The cosmetics in Washington and Oregon, does that include lead too, or just PFAS?
Yes,
Does include lead?
yeah, and so I can jump to lead now, but so Washington includes lead at a 1 part per million maximum contaminant level. And so that was kind of the conversation in the House, is industry wanted 10. We would prefer to see as low as possible, like 1, because we know there's no safe level of lead. There were rumors in the House that Washington was getting sued for their low level of lead. We checked in with the Department of Ecology, the Department of Health in Washington, and they don't know of any lawsuit, and they are planning to go ahead with their ban this coming January.
And what's Washington at?
1 part.
Or they're both at 1 point?
Oregon, I believe, is 10, and
Oh, Oregon
Washington
is-
is 1.
And Washington is bigger than Vermont, right?
Yes.
Okay.
Can I ask a question around water, lead and water, because I'm assuming there are water products in these cosmetics. Does Washington, with given that they have that 1 part per million, is their water just generally more lead free than Vermont's and other states? Does that come into play at all?
That's a good question. I don't know the answer to that, but from what I've heard, the contamination in personal care products is less from water and more from minerals. So a lot of the products that end up with high level of lead either have colorants, so lipsticks, or powders, so eyeshadow, blush, and face powder. So I think it's the actual minerals that are in those products that have higher levels of lead. And so what we've heard is that the industry standard for lead is 10 parts per million. 99% of personal care products out there are already below 10 parts per million of lead. And many personal care products companies are already testing their products for lead to make sure that they don't rise above that 10 part per million level. So what would be happening in Washington, I would imagine, is instead of a product coming back at 9 parts per million, they say, okay, that's good to go out to the consumer. They then have to, similarly, if it came back to 11 parts per million, source what ingredient has that higher level of lead, followed up the supply chain, and replace that ingredient with something else.
Do you know if states require labeling, says like this product contains lead?
I don't think so. I don't know if lead is included in Prop 65, but again, it's
Yeah, practically, but they don't have the same, that they have an EPA, that Prop 65 is California.
yes.
They have their little EPA system. That gets to the area of labeling, which is disallowed, I think, at the federal level. Really difficult for state levels to do that.
So I poured through some.
Difficult or impossible? So I think consumers should know that they're smearing levels.
Me too.
Just.
I don't think we have that. We'll ask the AG, but I don't think that we have, or others. But I don't think we're allowed legally to put labels. Not sure about that because it reaches out in a way that is different from chemical concentration. So, good question, and we'll follow up with that.
Thank you.
Yes.
So the FDA has done testing for lead in personal care products, and I didn't make, someone else on my team made this beautiful graphic, which I wouldn't have been able to make, to show these results. So when you see these numbers up here, this is out of the products that they tested. So for eyeshadow, 4 out of 23 of the products had above 5, and I picked 5 because I wanted to demonstrate that there are a lot of products that already fall below that 5 parts per million. It's not like this would be impossible to get products on the shelf that didn't have that much lead. So eyeshadow was the highest amount of lead, with 17% of the products having above 5 parts per million. But lipstick was 0.5, powder was 0, blush was 6, and moisturizers were 0. Again, blood doesn't often show up in things like moisturizers. So it's definitely possible to get down below 5 parts per million, and our intention is to make, with this whole bill, and I know yours is also, to make these products as safe as possible. And our issue with the 10 parts per million is because it's already the industry standard and 99% of products already meet it, by putting a 10 part per million standard in the bill, it doesn't get any additional, we might as well just not have it in there at all. It doesn't make the products any safer. And any additional state that is considering these cosmetics laws, which many are, then may also put the 10 part per million standard in instead of following states like Washington, which are pushing the industry to bring that level down.
I have a good sense of how lead affects the human body when it's ingested. What about when it's, topical? Is it the same?
My understanding is when it comes to powders, it's more inhalation. I would imagine there's also some exposure risk through topical, but I think the concern is that it just gets into the air when you're.
Okay.
So again, our recommendation would be to go back to that 5 part per million level, which is more conservative than Washington's 1 part per million level. I'll also say that Washington's again goes into effect January of 2025. Ours would be going into effect 2.5 years after that, July of 2027. And then there's already in the bill a compliance waiver. It's not, Katie can tell you what the language is, but it's an additional year for industry if they can't meet that. We would be opening to having language that pushes that even another year out if industry is still struggling to meet that 5 parts per million for lead, which would bump the date out to 2029, which is 4.5 years after Washington's goes into effect, and we should have plenty of time to be monitoring that and making sure that it actually is possible to get lead down that low.
So while we were talking, a bill that's near and dear to my heart, this was one of the first bills I worked on back when I spent time over in the education committee, was the water lead bill, which you both remember. And we put the level at 4 parts per billion. And spent a lot of time talking about what was a reasonable level. So just that's already in law here in Vermont as a lead level. It's at 4, so 10
Parts per billion.
parts per billion.
Bill,
And that's what
This is parts per million.
this is parts per million.
this
Oh,
is much
so it is a difference.
Yours is.
huge. So, go ahead.
I was just gonna comment about straight ingestion, which is
Sure,
primarily topical.
Yeah.
That are
yeah, but
Okay.
are you putting it on your eyes? I am,
Oh,
but
but
it
it-
making me a little,
Yeah, and kids are too. Kids wear
oh, yeah,
lipstick and blush and it's.
yeah.
And if you dye your hair and you use Grecian formula or whatever, it could lead. Okay.
So I will get,
That ship sailed.
I'll put this all in one PDF and send it over.
Thank you, that's helpful. And so it is helpful to know that other states are moving in the same direction. And, all right, good. So before we bring Katie back up, Bill, I know you want to comment, so why don't you do that now?
Sure.
And we'll go to look at both bills together, brief.
Yeah, yeah,
Let's do
I
this.
just want to sort of just give some background. Just to
Yes,
see
please.
qualities. So just to get at sort of where things are at with lead and cosmetics, and we certainly get more direct expertise from personal care products and non-drugs. But the fundamental question is, we're not talking about potentially added lead. This is lead that's in the actual ingredients, most of them like cultivation clays and things like that.
Can you speak up a little? 'Cause we're
Yeah,
back.
Sure, sorry. It's my understanding, subject to check, that there is no jurisdiction in the world that has a threshold lower than 10, other than Washington State. And it's very clear that to the extent that a level of one is simply not achievable with a large number of products, because the ingredients that are just naturally used. One of a couple of things is going to happen. There'll either not be a number of products or manufacturers making those products in Washington, or they will change the law before then, or there may be lawsuits as well. There you go. One way or the other, it's not workable standard. That issue, so relatively late in the consideration of S-25, the House proposed putting in one. They got that feedback. And then at the very last minute, they said, well, let's pick 5, which again, is not based on what anybody else is actually doing. And just timing wise, there wasn't going to be another round of testimony to come back and say, no, this is also not workable for a large number of products, including products that are made with Vermont. That's what led to continued discussion after the bill was put out by the committee, the development of consensus number 4 amendment that was on the House to change it up to 10, which puts us in line with everybody but Washington. And that was sort of the procedural issue. There wasn't a lot of time for like the testimony in committee. That was sort of the timeline. The problem with setting it at 5, it may not affect as many products as if you were to set it at 1. It does affect a meaningful number of products, including ones that are made here in Vermont. Right, at least there are at least 2 manufacturers who directly, explicitly raised concerns about what the impact of going to 5 would be. And what that is, again, putting aside the products would not be available to Vermont consumers who might actually want them. But these are contract manufacturers, they sometimes make their own products as well. The national companies that contract with folks like them around the country, they will no longer be able to contract with them to make these products. So you have that direct impact on jobs there. Concepts like, well, let's just push it out a couple more years and see what happens. These are not contracts that are entered into 6 months out. They happen over time. So you're going to have potentially negative impact on existing and future contracts, even if the actual date could be set in law with no guarantee that it'll change, is a couple of years away. The waiver of enforcement provision, which was included in the bill, that was one of the kind of details of these kind of bills that I highlighted from folks. Concern 197. That is certainly a helpful mechanism that's in there. But again, because of the lead time of contracting with these companies, trying to apply the waiver, which is saying the company in good faith, we cannot comply with this deadline in time. Can you document, make a determination from the AG, we will not enforce this law for X period of time. It's hard to have that line up with this because it's not something that's going to be fixed in 6 months. Also, it's a waiver of enforcement. I can guarantee you that the legal departments in any manufacturer is not going to want to enter into a contract with a Vermont company based on a waiver of enforcement. That's thin ice to be on it. You don't really know how long that's going to be in fact and how it was touched on a little bit. Obviously, it'll be great to have no lead in together. But when safety levels are set, part of the context is what is the exposure? So drinking water, very different than makeup. This issue, it's obviously been very thoroughly reviewed and considered by multiple jurisdictions around the world. And general consensus appears to be that 10 is an acceptable safe level. And that's just really the quick background. And
this is helpful.
Yeah.
And so we'll let a couple questions and then we're gonna move along because we want to get through
Yeah,
to the bill.
So
We've got 4 questions.
you're first. Okay, thank you.
Then Gulick, then Williams, then Weeks.
Okay, can pop back for, I think I already know the answer to this, but the federal government doesn't have any, or do they have a limit or a guideline or
I
anything?
believe the guidance is 10. I don't know precisely how it's articulated, like, mandate or guidance or what, and we can get that.
Okay, that would be helpful
Confirmation.
for,
Yeah.
and then. The stuff that's in cosmetics,
Mhm.
in particular. Is there, a sense of what is sort of quote unquote naturally occurring, I think, what's the level that's naturally occurring?
Right, so it will vary from component or substance to substance.
Yeah, of course,
But
yeah,
that's what we're talking about, when we talk about 10, 5, 1. It's not being added, it's what naturally is in the material.
The clay.
And and so that's what's monitored to make sure that your combination of ingredients doesn't go over 10. Especially it's by the very nature of products, you're not gonna find a combination of ingredients, so sometimes it's only one ingredient. That's in the product that always is gonna be available under 5. Again, not every product, but there'll be a significant number enough that are between where this would have really.
Yeah. and I guess. And you're probably not the right person to ask this, but I'm just gonna put this
Yeah,
question out there. You did mention, and the difference of exposure, and you're absolutely right that the ingest is obviously, and the billion and versus million is a big difference. But cosmetics, particularly the ones that seem to have the most lead in it, are on our eyes. That is right next to a plant
Right.
that, can be easily, if it's not exactly ingesting, but it's similar to it ingesting. If it's makeup, if it's lipstick, it's literally on your lips, you are ingesting that. That is ingesting.
Right.
So that is particularly concerning to me that, it's different than, putting nail polish on or something that you're not gonna eat. But this is basically getting internally in your body.
Sure, and I can only assume that whether it's the FDA or any other jurisdiction that has made these determinations have factored in that level of incidental projection or exposure.
Maybe.
I'm sure they take that into account.
So I want
Whichever one it is.
I want everyone to ask their question and then, because we're getting into conversation, which is not a bad thing, but we want to try and keep going, so. Yeah, all the questions and everything you're hearing now, if you're in the room, we want clarification. That would be helpful. That would be,
Yes, I always like to compare to Europe, and I'm looking it up right now.
oh, breach.
I,
Breach.
do you know what the lead limits are? 'Cause, I mean, you made a pretty big claim by
Right,
saying that
yeah.
Washington was the only one.
Right, and that's what I've heard from the people who are experts in the field. Very happy. I have actually made a request, we actually get a specific list of specific
Yeah.
mandatory,
Yeah.
because there may be, aspirational guidelines, like it would be nice if, but in terms of like actually is required.
We'll get there. So the EU breach is significantly different from our system, obviously.
Yeah.
And so one of the things we want to avoid is having all of the higher level of anything coming here while all the lower level of anything is going to Europe. And where so much of what we consume is produced in China, in Asia, it's a global market.
Yes, I agree with you.
Well, Mark can supply the entire world. actually.
So Senator Williams has a question and then Senator Reese has a question.
Go ahead. Quite simple. It's pretty simple too. So, wouldn't the industry simply shift sourcing if their clay, their base products were found to be more contaminated than another source? So say, for example, a Vermont producer would, if this law passes, they would simply shift to a raw ingredient supplier from an area whose clay was not so contaminated. That doesn't seem like a complicated shift.
So, and here more directly from the folks who actually are in the business of making these things, but the issue is, let's just hypothetically, they're not. The person actually designs these products, although you can hear from folks who do. Let's say you need red clay to make that by its nature, and being likely because of coefficient of iron, makes it right. You may find clay that has certain levels, but the difficulty of finding clay that's full of fire, it's just, you're not gonna be able to find that. It's just inherent in the kind of materials you're talking about, they're gonna have certain things.
So,
I just need to know what your name was, I didn't hear you.
Oh, I'm sorry, it's well, Bill.
Bill?
Yeah, William Tristan.
Tristan.
Associated with industries of.
2 L's at the end.
So, in a statement.
Yeah.
This is for everybody, we've heard, in 1970, when I graduated from high school, I worked for, sewer company. Put sewer lines in, and the line went right alongside the water in this town where I grew up. And what happened when we dug out next to it, pressure blew all cast iron pipe.
Mhm.
So when we had to replace the pipe, you know what the pipes were sealed with back in
I'm
the
sure they're student led.
lead.
Yeah.
Exactly, so so the infrastructure below the ground, nobody knows what it is,
Mhm.
has lead in it. And they use, how they put it in there, there's a ring in the big part of the pipe. And they heated it, and it went in, some of that lead got into the pipe, and sure.
Oh, and I believe even today, there are communities that have challenged to meet our water standards compared to the infrastructure elements like that, which, you know, it's a big project, yeah. So, yeah, I mean, you know, lead is out there, but people don't, they want to minimize it as much as possible, but there are gonna be some cases such as this where you can minimize it to the point where you simply don't have the product in question or the jobs that make them. And then the question is that level, is the safety of that level such that you would prefer that outcome or?
Okay, thank you. Do that. And you know what, if you can get something in writing to us, that would be helpful.
Yeah, I'll try to hopefully by tomorrow, if not soon, by Tuesday.
So, Adam, do you want to comment, answer just a couple of questions for us briefly,
Sure,
based on who you represent?
okay,
And we do need to go through the bill and look at what we did, what the House did, but we're in an area of interest.
morning, Madam Chair. Adam McGrath, McGrath Group, Personal Care Products Council. Here to be responsive to your interest on S25. 30-second level set, then specific, and then open it up. We've been working with PCPC for some time. They came to us years ago, kind of to the left of everyone, to engage us to have Vermont help lead the nation on getting microbeads out of personal care products. And so your good work was to pass kind of nation-leading legislation. We were here as an industry. PCPC are the top brands. We respect and understand there are offshore, off-label products that just surface that you have a battle with that are not consumer sensitive the way the major brands are. And so you're legislating in an area that's well intended, and we respect that. It is a challenge to have state by state legislation at an ingredient and product by product level. We support the bill as passed by the House, had trouble with as passed by the Senate. And so we appreciated your work last year and the way the House continued to develop it. There are a lot of nation leading moments in the bill led aside from the conversation. So good work in that regard, because we know that's the intention of the advocates and of this committee. So we kind of respect all of that space and are glad to be supporting the bill, because that's the nature for this trade council, to be with the front edge. Having said that, with regard to the lead matter, starting with the top, Kelsey Johnson from the trade group will be here on Tuesday, flying in now, already booked her ticket to be here to answer specific questions. And they've been here a bunch with scientists in the House. Like, it was a big scientist evasion multiple times up in the House. Top lines: we do not add lead as an ingredient. It's naturally occurring in certain raw materials, powder. No jurisdiction, subject to being backed up, has a currently applicable law that requires less than 10. Washington State's an aberration, hasn't become effective yet. It'd be different if this was 2 years after Washington that challenged on a number. and it had sorted itself out, but you're being asked to, get into the supply chain and have Vermont kind of drive the national supply chain. Okay. Autumn Harp is an employer that, you know, is very, busy making products in Chittenden County and has a great workforce. We're really excited. They have letters in to do, and Jess Oskey, who's works with me on this, encouraged me to stick closely to their words in this regard and not do any kind of stretching to make it sound compelling. So, we really hope you can check this letter out. But to answer your direct question, Ethan, PhD scientist out at Autumn Harp, the FDA currently regulates color additives under Food and Drug Cosmetics Act that limits lead content to 10 parts per million for the vast majority of color and synthetic and mineral-based products. So CFR to follow up with that. And so there is a national standard that's being kind of respected. To establish the 5 part per million allowable limit for lead in cosmetics, Solar State would have significant negative ramifications for our business. It's in the raw material.
Questions? Now are we at questions?
Sure.
Good.
So again, I don't know if you're the right person to ask, but you can bring this back to your people. So raw materials and naturally occurring are, if they're using powder that's essentially, for lack of a better word, dirt, you know, some kind of soil-based, you know, thing, which I know a lot of sort of natural cosmetic firms use, like Autumn Harp does. That is a natural substance, or presumably, or hopefully, whatever, it's a natural substance, but many, probably most, I'm not a manufacturer, but many products are not made by natural substances, they're made by synthetic substances. So to claim that a synthetic substance has naturally occurring lead levels is
I'm prepared for this moment.
you are?
Yes.
That's bogus.
It's a good question.
Yeah, well, allow me to clarify that.
Okay,
The limit might go against someone trying to, going below 10. Says Hillary Burroughs at Autumn Harp. The limit might go against someone trying to do environmental positive thing. For example, you might see a higher lead content with a natural mineral sunscreen in post-consumer recycled content plastic tube than you would in a chemical sunscreen in a virgin plastic tube. So I'm not making a overly broad statement saying naturally occurring ingredients are in every product. If you use brand new packaging that's not been recycled in purely synthetic sunscreen, well, sure, then I think the lead conversation is less prominent. Consumers want naturally occurring, and it's a big sector of the market. So, and policymakers want post-recycled content.
right,
So like we're getting.
but they also
multiple
want
signals.
products without lead in them.
Well, we're
So-
at a global standard that has been the case, and so when we're not, so along that regard, I'm also prepared. We do not intentionally add lead.
No, I know that, but I'm just, I think that there's got to be a, you know, just because something is a natural product doesn't mean it doesn't have harmful substances in it. And if it's being used to put in our eyes and on our lips, then we just, maybe naturally occurring is not better.
That's definitely a consumer
This
choice.
this is a question that we need to have answered. Right, and where the fine line is and the products that have naturally occurring versus synthetic. So when your expert gets here on Tuesday and or Wednesday, we'll see what our schedule is.
Sure.
We can ask this question again and get into the conversation.
Yeah, my goal was to stir it up so they.
This,
can,
right, you gotta
some
stir it up,
kind
you
of-
got it, we're stirring it up, we're hurrying to
So-
stir it up again.
You can, and we're happy to meet you and battle that, but there's tension on the recycling content.
There's certainly
natural
intention on it,
content.
and it's, so what do you gain, what does a consumer gain by doing the naturally occurring? Is
are there fewer other bad things?
Well,
Because that is pretty bad.
I'm gonna suggest-
well, it's a discussion point for naturally occurring because it's in our life, right? Like, what I'm hearing is if kids roll in the dirt, there's gonna be some lead in that childhood experience. And so like, we have to sort that all out, but all I can say is there's no active law right now that has lowered that standard.
So we're gonna do this, this is a good discussion, great. Senator Lewis has a question, and in the last few minutes, I wanna bring up the conversation as well as that.
Maybe I missed this, but what are the current limits in the state of Vermont?
For nothing in cosmetics,
There's no,
nothing, this is different. It's in water, which is different, it's separate.
right,
It would be maybe helpful to have some comparison on what are the lead levels for various things already in Vermont, like the restrictions. I mean, I
But
mentioned the
children's
water one.
Jewelry has lead level.
Right, and paint, and there are other, so just
Paint.
having that sort of comparison chart of. Yeah, so we can see how that differs. Maybe you guys have something like that. Maybe make something like that. Thank you.
Can we get something like that? I know, because we went through a long discussion on children's jewelry, and we were working on lead
Yeah,
and mercury, it was all about what level and what age. Of course. Yeah. So, and it's easy to forget the levels. Katie, what I wanted to bring up, committee, we're getting the information that we need on the difficult part of the bill. So this is a transition point we're gonna have to face. So the next time we meet, we'll go through the two bills together. Time to do that today. So we'll look at House and Senate, we'll get some testimony, try to answer the questions you have. So make sure you're asking the questions now, or that, ask who you would like at that setup. My consideration might, right now, to talk about enforcement, because there's nothing in the bill on enforcement. And the question is, at the levels that Katie had listed, the enforcement through the AG's office, maybe you could talk again, Katie, about what those options are. There's private right of action by private parties, there's private right of action at the AG level, and then there's enforcement of some other 2453 AG.
Thank you. Katie McGlynn, Legislative Council. So the language that's in many of the subchapters in the consumer protection chapter has this language. The AG has the same authority to make rules, conduct civil investigations, enter into assurances of discontinuance, and bring civil actions. And private parties have the same rights and remedies as provided under subchapter 1 of this chapter. So I guess the initial question is, do you want to add something? And 2, are you narrowing it to the AG would bring enforcement and be in charge of enforcement? Or is it broader in that a private party could bring a cause of action under this?
Okay, so then I think that really is the question. Is it private party or is it solely at the AG level? If you open up to private party, what are the implications of that?
Well, the implications are that it's broader and gives an opportunity to litigate. I was wanting to look at the underlying language for what we have in the existing law that did have enforcement language that didn't get carried over. So let me take a quick look and see what's currently in place. This would be for like firefighters, this and all, and food packaging, rugs and carpets. Then you could choose to be consistent or not consistent. So you have a penalty section. Right now, this is a violation of this chapter shall be deemed a violation of the Consumer Protection Act, which is now where this new language is going to be living. The AG has the same authority to make rules, conduct civil investigations, and enter into assurances of discontinuance and bring civil actions. And private parties have the same rights and remedies as provided under 9 VSA. So what you have now is this full text of what I just read to you. And that, again, the bill did not move along with the rest of the language. If we would like for that to happen, we would have to add that.
So what I'm gonna ask, of course, where this is a committee discussion, and anyone who's in the room wants to comment on this, will take written testimony, or perhaps when we have testimony to speak. How frustrating it is to sit there. So committee, what would you like to look at in terms of this when?
So I think your question specifically the private right of action.
No, my question is on enforcement and what we put into the.
So I'm gonna
Nothing
specific,
there.
to your point then, specific to private right of action. Is this an option where the private citizen sues whom? The state for not protecting them or the industry for potentially introducing toxins?
Potentially, the private individual would have a right of action against a manufacturer who doesn't.
But not the state if we don't.
That's a better question for the AGO's office, how they use this.
We'll have, we'll go with the AG, and I want to prime this up a little bit, because that's a good question to ask them. Any other questions for Katie at this point? So private right of action though, so suppose someone uses eyeliner day after day after day and suspects that it caused some mental disorder, or if someone uses, some powder as a statement. Powder every day, and decides that that has caused the skin cancer that they're experiencing. So what level of proof then, I mean, these are the kinds of questions we don't know.
Right.
How do you bring an action with that?
I do have a comment from a constituent of mine who's asking, how will the AGO office investigate the claims potentially made by companies that PFAS is necessary to their product? So apparently that's part of the bill. And it's a good question.
Yeah.
How's that gonna?
So when we'll go through the bill, again, I think each of us go through the bill and look at the language specific that relates to enforcement, and then any of the other things that
Investigation.
stand out. Gary, go ahead.
Back to the private right of action, and back to the label. If we just require a manufacturer to put a label that says it's not legal in Vermont, somebody in Vermont opts to use it. And that's maybe a good question for the.
That would be interesting. So that's a question also about FDA regulation of labeling, which is out on line, and what they do to regulate labeling and what role the state may. But Katie, I don't know if you can answer that question, but or maybe that is the AG that answers that question.
Honestly, I've been multitasking and answering.
I know, it's
questions
okay.
from the committee.
No, the question went back to the labeling and
Oh,
where
the
the
labeling?
authority lies for.
I think a lot of it depends on what type of product
Yeah.
it is, because different products are regulated differently. And, cosmetic and personal products are going to be treated one way. I know in general, there's a sort of proceed with caution principles, so when we're labeling products, so I think anything that were to be done would have to be narrowly tailored. I don't think that's what you're proposing right now. I think you're just asking out of curiosity.
Yeah, if we, I'm thinking that diving into labeling right now might be a whole new world. We've been through this with, children's products and QR codes. Better go with that question.
No,
Send a week, don't say a question. So, a lot here.
I think maybe like the ninth hour and too late, but I do think that informing a consumer that the product they're using is toxic, it makes it a choice. We can't regulate. If we can't regulate it,
Yeah.
then it makes it a personal choice, which has personal ramifications.
So, yeah, and I think it's a step that we need to consider and how that happens. I do know that if you look out on the webpage for the Department of Health, they will frequently they have a lot of information about making consumer choices. So it could be. Look again at what's included from the House on a PFAS study group. And maybe there's something we can add into that, so it does have proposed a PSA program, website content about public health risk of PFAS exposure. It's all about PFAS. We also have a community engagement plan for Vermont Department of Health. Regulated to the regulation, maybe there's something we can put there, so as you're reading just through the outline, maybe it'll spark.
What section?
I'm looking at page 4 of 5.
The implementation plan.
Yeah,
If we're not gonna do it in this bill, I hope those of us who come back for another round next year can maybe deal with this. To me, it's absolutely ludicrous that people, that manufacturers can't or don't or won't put information on their labels. Knowledge is power. And I agree with Senator Weeks, if you're making a choice, you want to be informed of your choice. It's just crazy to me that we can't.
so then, the question is.
Going to the website's not, is not.
No, I understand. I'm not suggesting that. What I'm suggesting is that there are currently federal laws, rules on cosmetic regulation. If you look up on an FDA website, you'll see that. And the question is, what's left to the states in terms of labeling and providing consumer information? So how can we, what can we do? So that's the question. And it is a step beyond what's currently in the bill. And it's a big, huge step, which may cost dollars to do. So if you want to let the public know, somebody's to pay for it. But that's FYI, would be big. So we've got a lot to think about as we look at the bill.
Where's the cost? I'm just curious.
Well, if it's Department of Health, even Department of Health is putting out a PSA, every time we ask them, they'll say, well, it's gonna cost between $2,500 and $10,000 to do one PSA.
The labels are already being created, so.
Well, then the industry will say we have to change our labeling type. And if remember that we now have labeling on cigarettes because it's so horrible to smoke this stuff, right? I did do fine. Hey.
Oh, it's a good parallel.
It is.
You wanna say
Yeah,
something?
labeling, no choice.
Thank you. But. Which is what we were missing here.
Oh, but I'm sure.
Okay, so when we come back to this, we have a lot of questions you've asked. We've got folks who will get in to help us answer those questions. And not the least of this, which is any federal regulation that we cannot violate. Okay, thank you. Thanks a lot. We'll call a wrap for this, and we're not ended. We're moving on to the next topic, but what else do we need to know? Make sure I have that information and what you need, and we'll try and find someone again.
I think you have.
Okay. All right, we're good. Okay, so is Ben on? Oh, no,